Michael Duffy. I'm an orthopedic spinal surgeon with the Texas Back Institute. I do a lot of sports medicine type spine work. A lot of the things that I do are also degenerative spine surgeries as well. I definitely have been active my whole life in sports. Played multiple sports in high school. In college I actually played golf and hockey at Georgetown. And that's one of the reasons I went into orthopedic surgery, is to treat athletes and young people who have injuries and conditions, and we can improve their function and their ability to play their sport. And that's what I've also done with spine surgery quite a bit. I take care of a lot of athletes in DFW, a lot of high school and college athletes, as well as professional too. When you look at the older weekend warrior type athlete, the most common thing that I'm going to treat is going to be a disc herniation, either in the cervical spine, which is the neck, or the lumbar spine, which is the low back. A lot of times guys or girls work throughout the week. They go play athletics on the weekend, whether it be flag football or basketball or something, and they're not as conditioned as they used to be, and they can get these disc herniations. When you get a disc herniation, that can give you referred pain into the arm or into the leg, which is because the nerve is being pinched. So a lot of times I'll get guys that come in to the office after playing a sport in their 40s, and they have a disc herniation. So that's really the most common adult kind of athletic injury. Obviously, you know, muscle strains and pulls and low back aches is very common as well, but a more significant injury would be the disc herniation. In regard to kids, or what I would consider a pediatric population, teenagers that are very active in athletics, there's definitely the muscle aches and strains and whatnot are very common, but there's also another condition which we see quite often in athletics, as far as gymnasts, cheerleading, football. Anybody that has a hyperextension of the back, they can get what's called a spondylolysis, which is a condition that affects about 6% of the population, and it can be chronic low back pain, especially in a young athlete, and I treat that quite often too. The first line of treatment is not operating. We like to do bracing, medications, physical therapy. In regard to the weekend warrior that gets a disc herniation, a lot of times we'll do a steroid shot. Very, very effective. The literature shows that they can be up to 70% effective for people with these nerve pain that goes down the arm or the leg, to have these steroid shots. In regard to the kids, especially, you know, that have the condition I spoke about, the spondylolysis, first line of treatment with that is bracing. Put them into a brace and shut them down of all athletics. Usually 2 to 3 months later, the pain of that fracture, and it's actually a fracture, kind of a stress fracture, the pain of that subsides and the bone can heal. So again, 90% of what we do is non-operative. When patients continue to have pain despite the conservative treatment, then we talk about surgery. For like the neck, if you have a disc herniation, the neck, and causing pain down the arm that's unrelenting, especially in younger patients, I like to do disc replacement surgery rather than fusion. Disc replacement surgery has been shown to have equal, if not better, results than the fusion, and it also protects the level above and the level below the surgery from advanced degeneration compared to a fusion. In the lumbar spine, if it's a simple disc herniation, we just do a discectomy, where we take the small piece off of the nerve through a small micro incision, and people are usually able to get back to doing most of what they want to do within a few weeks.